I'm scared a little bit. Okay. So, hello everybody. Okay, good afternoon. I think it's the same. So, today I'm gonna talk about Nipah virus. Okay, more louder. I'm gonna talk about Nipah virus. So I hope that, or if of any of you have any idea what is Nipah virus, or if you have heard about Nipah virus spreading actually around India, have you heard about the news? Yeah, so yeah, actually is back again in some, especially in West Bengal. I think 5 people have been actively have Nipah virus and all. So I'm gonna explain you that. We're gonna go through that together today. Okay, so what is Nipah virus? So it is a highly pathogenic ozonic virus who can switch to animal to human being. So it is a virus who's belonging to any virus genome, which the family is the family. So sorry, I'm gonna run spelling many things. So it's a deadly a pathogen first emerged in scientific literally during the 90s. So and it get back recently, so it catch the attention of people. So it's a virus primarily maintained in the nature by fruit bat. Actually, that's a fruit bat over there. So the fruit bat carry those virus easily in their metabolism, so it doesn't harm them, but they can easily transmit it to another animal and human. So to us, it'll be really harmful, and those animals as well. So the bat self has a natural reservoir carrying the virus without showing any symptom. So when the virus jump from the bat to human or intermediate host like pigs, so it causes severe and often it's a fatal disease like for us when it's not treated. So human infection typically present with severe encephalitis like brain inflammation and acute respiratory distress, make it one of the most concerned emergency infectious disease in the region actually. So let's talk a little bit about history. So the first outbreaking happened in 98 to 99, first in Malaysia and Singapore, exactly. So do you have any idea where the Nipah name coming from? Any idea? Okay, actually, the first outbreak happened to one small village in Malaysia, and the village was called Nipah. That's why the virus take the name like Nipah virus. Actually, it's not noted down there, up there, but yeah. So Malaysia and Singapore experienced the initial outbreak among pig farmers and abattoir workers. So 265 cases reported with approximately 40% fatality rate of death. So the outbreak was stressing by pig farmer near bat habitation. As I told you before, the virus can jump from the bat to a pig, and if you're a farmer worker, obviously you have some pig and all, and getting approach to them, there can be some transmission to you and all. So then the virus reappear again in 2000, especially and that moment only it came in Bangladesh and in India specifically, and often with highly fatality rate than the original first outbreak in Malaysia. So direct bat, that was a direct bat to human transmission, which become evident through contamination of dead palms subconsumption also. Yeah, because also the human can contract this virus just when the bat eats some fruit, and after that you just touch or maybe have the same fruit also, you can contract the virus like that. And then after it happened again in 2018, specifically in Kerala. So in May 2018, an outbreak was reported in Koshikodi, I hope I'm saying right, so district of Kerala, India. So 21 deaths were recorded, and include one healthcare worker among a total of 23 cases. The outbreak demonstrate efficient human-to-human transmission and prompt national-wide alert. So after you get it, the disease from the bat, it's little bit like coronavirus, a human is infected and you're approaching another human, so you can easily transmit that to another human by respiratory tract, body fluid and other stuff, even by sweat you can transfer that too. other people. So recently, to 2023 to 2025, so a confirmed case continued to emerge in Kerala again and other Indian states. So WHO and India health authorities maintain active surveillance and response protocol. So specifically on 26 January of 26, so the National ISR focal point of India noticed WHO of two laboratory confirmed cases. That's very recent. Yeah, that's just 1 week or 2 weeks ago. Case of Nipah virus infected in West Bengal state. Both are healthcare worker at the same private hospital in Barajsat. So I think the virus is coming back. So let's be careful. So this is we're gonna talk about transmission. So be careful. Maybe if you get bite by a spider, you might become Spider-Man. By the bite, you might go to hospital. Okay, let's talk about how the Nipah virus spread. As I told you before, animal to human, so direct contact with infected bat like urine, saliva, or contaminated fruit consumption, specifically date. Like that's why they call it fruit bat, because like they're like eating those fruit and all on the tree, and all, hopefully, because like they say sometimes bat like blood, but I don't think if that's real. Okay, so exposure to the infection pig also and other body fluid. So as I told you, so animal to human, when the bat also eat those fruit and it fall down, maybe a pig or some other animal can have them, and when you get in contact with them, like that can happen, like the body fluid of those animal can like transmit the disease to you, like the virus to you. So pig act has an amplifier in some region, like where farmers are living the most. So virus replication efficiency in pig. So pig often develop like mild or no symptom. So sometimes respiratory system also like a sign, like cough and some other stuff. As you can see also in this small, drawing. See a bat over here, eat some fruit, the pig will have it, the farmer will fall. And also when you are in contact with urine or excrement of the bat, that can affect you and you'll spread them on person also, or directly bat to human contact also, then it will lead to human and human contact. So the next is human and human contacts as well. Close contact with an infected patient through respiratory droplet exposed to body fluid include blood, urine, and saliva. And caregiver and healthcare worker at particularly high risk. Yeah, they are in high risk. So the incubation period is a range of 3 to 14 days. It's like you might contract the infection, like the virus, but maybe you will not know. But it will be maybe during that 3 or 14 days when you start to see some sign of the virus or something like that. But in some rare cases, it can go till 45 days before you notice that. So the laboratory diagnostic of a patient with a clinical history of, let's call it NIV, so infection, can be made during the acute and convalescent phase of the disease by using a combination of tests. Like they're using specific tests to identify, to diagnostic the virus. If the test must be done like earlier, the better earlier, the more safe and efficient it will be. So the tests are RT-PCR, like from body fluid, and antibody detection with ELISA. Yeah. So typically 3 to 14 days from exposure to symptom onset, can extend to 45 days. That's not confirmed, but it happened in some case. So in a limit transmission possible during incubation. So as you can see, high group include a pig farmer, worker in bat habitation, like date palm sap, collector, healthcare worker. Also, they are the most exposed to this disease, and the family member also who can carry the the disease and spread it among people. Now we're gonna talk about the virus itself. So as I told you before, so it is a virus who's possess a single strand RNA genome. So it belongs to the family of paramizovirus family. So it says it have a surface protein allowing to bind and to bind to receptor on multiple cell, particularly endothelial cell lining blood vessel and neuron in the central nervous system. So it is a virus who is composed of a different code, like as you can see, if you can see the protein code FGNLP and viral RNA M, and lipid also. So all this code allow him to just stick to other cells and just to get inside them and start multiplication. So RNA virus have a higher potential of infection new hosts due to their incredible short generation time. Actually, it's a virus who is very, let's say, unstable, because it is very easy for him to mutate. Like when he is just spread to another host, like he can easily mutate and just get to your immune system fastly and just start the replication. So as I told you, it's a matter of time. Whenever you're feeling the symptom and all, you need to really go do a checkup, because the earlier you've done it, the more safer you'll be. So in the short generation time, and their ability to evolve faster due to high mutational frequency. So the virus enter the body through respiratory tract and mucosal members, so then spread via the bloodstream to various organ. Its ability to infect endothelial cell is particularly devastating, causing widely spreading vascular damage. So here we're gonna, I told you about already the code. The code, like the different code, is like 6 structural protein, which are fusion protein F, attachment glycoprotein G, matrix protein M, phosphoprotein P, nucleoprotein N, and the large RNA depend like RNA polymerase protein L. So further, as you can see in this image. Further, the P-gen code from the non-structural protein will include the V, W, and the C protein code, which I don't know, yeah, which from the non-structural protein code, and then the N and the P, the N, P, and L protein in conjunction with the viral iron form the virus ribonucleoprotein. Is a complex that regulates the transcription of the virus genome and the virus replication. And different investigations also have reported that the N glycan, of the Nipah glycoprotein, it acts as a decoy. I think it should be noted somewhere. It acts as a decoy barrier to protect the virus against the antibodies and all. This is how the virus, when he enters the body, is protect himself with this. And we're coming down here to the initial infection. So as I told you before, the virus get through the respiratory route as the primary. That's the primary way of spreading of the virus, through the respiratory tract. So which enter the host and study involving infection pig, and even through of the animal. We noticed that also, like an animal, the first manner of spreading of the virus is through respiratory tract also, like for the pig and other also animal also. This is the way the virus is spreading. And we talk about also the viremia. So it's the virus, that's when the virus entered the bloodstream and it's ready to spread all through the body, So with the disease progression, infection affect the brain, the digestive system, and the excretory system also. So entry of nerve inside the central nervous system can happen due to multiple reasons, such as replication. As I told you, the virus is very fast. As soon as it gets in your body, the first thing you try to do is just to divide and multiply himself. So after multiplying, it'll be very easy for him to cross the blood-brain barrier and to reach your brain. And that's the most part he'll be going the most, and it can affect your immune system very easily. So as I was saying, so due to multiple reasons, such as multiplication of nerve in the endothelial cells, resulting in the compromised integrity of the blood-brain barrier. So the transmigration of nerve bone infected leukocytes into the brain, and the transfer of nerve through the nasal cavity into the central nervous system via olfactory neuron. So now we're going to talk about also the host a pathogen interaction. So when the virus gets inside your body, like on the virus, the P, I mean the F and the G protein are the essential protein which are be using to grab the other cells like in your body so that they can easily enter to the body. So like the F and the G protein present in the viral envelope of Neve control virus attachment, and it enter into the host cell. So the ephrin B2 and B3, which are host cell receptor found on epithelial cells and neuron, respectively, serve as a binding partner for the G protein of the Neve virus. So the virus replication on bounding, so the binding of the G protein with the epinephrine B2 and B3 receptor, followed by viral entry, triggering the release of and duplication of the viral mRNA and Neve. So yeah, the virus also can occasionally remain like in dormant form. Like as I told you, we have seen some cases like 45 days, like before like incubation during 45 days. So the you might have the virus, you might contract it, but you will not show any action yet. You'll be in sleeping mode. After like maybe some trigger, you'll start acting again. Actually, I wanted to play also a video that will explain more well how the drug is replicating in the body. And now we won't take time, just a quick video.
Hey there, I'm Marok.
I'm just gonna,
Those cycles
especially this part.
interfere. See, which is by the future
So,
of Nipah virus. Attachment and absorption. The viral glycoprotein T and the B2 receptor help the virus bind to its host cell, which is then followed by the fusion of viral and host membrane. Penetration and biosynthesis. The transcription of viral messenger RNA, which is then translated into viral proteins, uses the genome of the negative RNA as a template. Additionally, the synthesis of cRNA plus uses the vRNA as a template, and C plus in turn uses the vRNA as a template. Additionally, the viral protein contributes to interferon signaling. Additionally, the cell endocytose and mature the S proteins. Assembly: N, P, C, M, S, and G are all included in the viron during assembly, which is predominantly carried by the M protein. Release: the virons are expelled from the cell after budding through the host membrane, which has G proteins on its surface. Let's learn about its pathogenesis. Number 1. In the initial stages of Nipah infection, the virus can be observed in epithelial cells of the bronchioles. Number 2. Nipah virus antigen can be identified in both the bronchi and alveoli. Number 3. Infection of the airway epithelium triggers the activation of inflammatory mediators. Number 4. As the disease progresses, the virus spreads to the endothelial cells of the lung. Number 5. The virus enters the bloodstream, disseminating either freely or bound to host leukocytes, ultimately reaching the brain, spleen, and kidney. Two distinct pathways facilitate viral entry into the central nervous system, one from the hematogenous route and the other interrogately with olfactory nerves. Infection of the central nervous system disrupts the blood-brain barrier, leading to the expression of interleukin-1 beta and tumor necrosis factor alpha, resulting in development of neurological symptoms as indicated in red font for human symptoms. So, to summarize it, through the oral nasal pathway, the Nipah virus infects the host and spreads. It is still unclear exactly where the human first replication occurs. However, because of the large amounts of antigen present there after infection, the lymphoid and pulmonary tissues are regarded as potential first replication sites. Acute respiratory distress syndromes like conditions can be brought on by the viral antigens that can be brought in the bronchi and alveoli. These cytokinesis cause inflammation. The virus subsequently spreads to the lungs endothelial cells in the later stages of the illness. The virus spreads as a result of early viremia, and then the endothelium becomes the site of secondary replication. The Eprin B2 receptor on the endothelium, as well as on the lungs, placenta, prostate, blood vessels, and several other organs, is where the
Sorry, some internet issue.
viral glycoprotein G finds. Eprin B2 is highly conserved across multiple animal groups, with similarities between bats and pigs of about 95 to 96%, which helps to explain the great variety of hosts connected to the Nipah virus. The virus enters the brain either retrogradely through the olfactory
Sorry.
neurons or hematogeneously through the bloodstream. It produces interleukin 1 and tumor necrosis factor, which causes
Okay, sorry, we're having internet issue here. I hope that you understand that part. Okay, I think I will just continue then. Yeah. Okay, next we'll come to the sign and symptom. Okay, so in early phases, like in 3 to 14 days, like post exposure, so we can notice that like some changes, like the body temperature will rise, like headache, like certain individual may even having cough, respiratory discomfort, and all, sore throat, and difficulty swallowing things, and dry cough also. So in the progressing phase, we have like drowsiness and altered mental state, confusion, and disorientation. You have seizure as well can happen, and in several cases, rapid breathing and respiratory distress. And low blood pressure also can occur, and shock. So in critical phases, we can see that like it will mostly attack the brain, like brain inflammation and convulsion and coma also can occur, and severe respiratory factory failure, like which need ventilation also, like respiratory tract failure, and multiple organ dysfunction syndrome also can occur, like cardiovascular and excretion system also. And we have also the important note, I think that I've told you before, like the incubation time has been reported to be lesser than 15 days. But however, in certain cases, it can go to till 4 months or more. So as I told you, the virus can be in sleep mode inside the body, but still you'll be affected. You are positive of the virus, but still you'll be there. So you need to find a way how to diagnosis and maybe remove it from your body. So actually, we'll talk about the diagnosis. So as I told you, like to accurate the good diagnostics of this virus, you need to be in the beginning moment when you contracted. I know it's been very difficult. Like you have like small symptoms like headache, cough, or something. You will not really thought about that. But I think in this moment, when you are really living in some area like Kerala and those I don't know those areas, we should think about it a little bit. Yeah. So accurate diagnosis requires specific laboratory testing since symptom overlap with many other infection disease. So early and defective, the defective diagnosis is critical for patient management and outbreaking content. So we have like three way to diagnostic the Nipah virus. The first one is RT-PCR testing, which is a reverse transcription polymerase chain reaction, which is detect directly the viral RNA in the blood sample, throat swab, or cerebrospinal fluid. Because when the virus starts its replication, what it like to do is to cross the blood-brain barrier to go directly to the brain. So just to having some cerebral spleen analysis can help to diagnostic the virus. And also we have the serology test, which is use the ELISA and other antibody detection method, like identify the IgM and the IgG antibody of the Nipah virus, like usefully for confirming also past infection and later stage when the virus may be undetectable. And we have also a virus isolation test, which is a cultivation of virus from the clinical sample. That is a high contamination test, also is a risk to take and also is costing more money. Yeah. So we have also some imagination test also, which is MRI, CT scan, and lesion chest X-ray scan also, and pulmonary, X-ray of pulmonary also, and respiratory, and those kind of tests also. Then we'll talk about the treatment. So actually, there is no antivirus for this Nipah virus yet. So, as currently has now, there is no specific antivirus treatment or approved vaccine for Nipah virus. Still, research are going on to find some solution and all. But so far, so according to the infection disease Society of America, so the antiviral drug ribavirin could be employed to treat NIV, so encephalitis. Like even though ribavirin efficacy is combating NIV is unknown. It's not like perfectly known like the effect of ribavirin, but still is like a little bit like I think coronavirus. We're using chloroquine, I guess, if I'm not wrong. Or, I don't know, something like that. So, also due to the lack of effective vaccine and therapeutical against NIV, so the National Center of Disease like Control in India have recommended the use of ribavirin also, and agonicid analog in confirmed like against NIV cases and all. And instead of that, the good thing first it will be to have some supportive care component, which is intensive care unit, medical ventilation, fluid and electrolyte management, managing seizure, blood pressure support, and treatment of secondary infection. And this is the table of the current treatment which are going on in the like in hope to find a solution to the virus, like for the treatment of the virus. As you can see, like ribavirin inhibit viral RNA replication, so it reduces the fatality by 36% in NIV encephalitis case. So that's why it's been using right as the first drug actually to really stop or limited the fatality of the virus. So you have some limitation also. How you see teratogenic infective in vivo model, and you have some side effect also. And also there is also the antimalarial chloroquine also is using like in further with viral entry and replication, and effective in vitro and in vivo also. But after some tests, it failed to prevent fatality in some hamsters. So yeah, that's a limitation of that. So these are different drugs which are going on, which are tested. So to know if the efficacy of those drugs can be used to treat the Nipah virus. And also these are the experimental also, as I told you, experimental therapy under investigation are going on. Like we have monoclonal antibodies, which are some lab are doing some research about that. Antiviral drugs also are used, like remdesivir and favipiravir, sorry for that, demonstrate active efficacy against Nipah virus, like in vitro and in animal models also. We have also like some convalescent plasma. So plasma from recovered patient containing antibodies have been also used and experimented with mixed results during outbreak. So still the research are going on. So we hope we'll find a solution for it. And now we'll come to the preventive and awareness. So I think we already know how the virus is spreading and all. So there is some prevention and some awareness that you should spread to among yourself and among people, which is like washing your hand frequently and avoid contact with some animal, especially pig and bat, and also like avoiding a drinking product that could be contaminated by bat, like specifically such a road date. I think they're talking road date. Also, it seems like it's a fruit that bat like a lot, maybe. And wear glove and mask, and yeah, and to protect yourself, and also, as you can see, like avoid animal contact, like safe food or practice, because you can go like when the animal eat the fruit, when you eat it, you can get it also, and a surveillance system also, like disease surveillance network to detect case earlier, because the as I told you again, the most early you find it that you are affected by the disease, so you have more chances to reduce the fatality of the disease. And also the hospital should be maintained isolate, like the facilities should be like isolate and not to not spread the contamination in the city and yeah, around. So in conclusion, like so the mortality of Nipah virus is still between 40 and 17 rate. It depend of it's depend of the early diagnosis of the late diagnostic. So the incubation can go to 4 to 14 days, and still there is a zero approval vaccine for that. But still the treatment are going on. So yeah, so and also the government and the authority and the healthcare also are providing many, are doing research and all, and they are trying to prevent for future outbreak and all. And one second. Yeah, so actually, if you want to go for a quiz to know a little bit about like Nipah virus, C. Okay, which family of Nipah virus that belongs to? Okay, it's C. Yeah, the answer is just here. That's why I'm trying to hide it. Yeah, you won't see the answer. Okay, say B. Okay, that's correct. And this one, C. You sure? Try again. Okay. So, yeah, he surely saw the answer. Let's see. B. Oh, actually, it was D. Yeah. Prevention. I think that's a little bit easy. B. You sure? Yeah. History. Malaysia. Yeah. And yeah. Yes. Go back. That's it. Thank you.